Hello, good evening, and how you day? How are you? Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. Nigerian time. In case not your first time where they see me with this, you dey welcome. And for here, we dey teach, we dey educate, but we know they treat people, we know they prescribe medicine on social media. Now, today's program, we dey talk about tuberculosis. But if you dey watch this program and we don't end, we no go fit respond to you. You understand? Because the program na 8 p.m. to 9 p.m. Nigerian time. So if you dey watch the program when we don't end, we no go fit respond. But right now, I dey live, and before we start, good evening, everybody. Tell me, how are you? Where you dey watch me from? Oh yeah, let's go, everybody. Let's see. Chiwendo, good evening. I see you. Omolade Olabisi, how you dey? Okay, Chiwendo dey watch me from Worry. Oh yeah, everybody, if you dey hear me, just put them in the comment section. Tell me where you dey watch me from. We dey live on Facebook. We dey live on YouTube. Yes, I can see. Some people they watch me already on YouTube, and some other people they watch me for Facebook. So good evening, everybody. I'm watching from Oyo. Okay, welcome, welcome. So tonight we are talking about tuberculosis, TB. TB. Now we want to talk about. But before we start, quickly, everybody, oh yeah, tell me where you dey watch me from. Let me see. Watching from Edo State. Happy. Happy is watching me from Edo State. Abiola is watching from Lagos. Linda is watching from Lagos. Faith is watching from Auchi, Edo State. Faith, how are you? Precious, they watch me from Kogi State. Moses, I see you, Moses, from Aja. Yes. Welcome, ladies and gentlemen. Happy Sunday to you and welcome. Now, before we start, I want you to tell me what you understand by the word tuberculosis. No check internet, no check anything. Just tell me from your head and your hand. Oh yeah, type 'em. I dey wait for you. Honeybee, Dim from Niger. Oh shit. Okay. So I be the host of the program. My co-host now, Dr. Israel. Dr. Israel will soon join us. And when he come, we go discuss. Somebody they watch me on YouTube. Juliet Richard, how you doing now? How is the family? Fatmata is watching me from Sierra Leone. Amaka from Lagos. Oh yeah, everybody, go to the comment section. Tell me, what do you understand by the word tuberculosis? As you dey type am, oh yeah, share the live. Everybody, like share. Yes, Taiwo, they watch me from Canada. Nice. How is Canada now? Cynthia from Anambra. Oh yeah, everybody. What do you understand by the word tuberculosis? And then share this live session. Dr. Israel is in the house. Happy Sunday. Happy Sunday, Juliet. I see you. Happy Sunday. How far? Felix from Niger. Oh yeah, everybody, talk to me. Dr. Israel, are you ready? You're ready. Okay, Dr. Israel is ready for us. So I want to bring up my co-host, so that we will discuss tonight. Let's go. Dr. Israel, good evening. How you day?
Good evening. I'm fine. Happy Sunday to everybody, and happy World TBT Day.
Yes. Today na the World TB Day. So before you enter, Dr. Israel, I dey ask everybody where they watch us now. Everybody, wherever you dey watch me, Lagos, Nigeria, Ghana, Cameroon, Sierra Leone, Canada, Germany, Italy, France. Wetin you understand by the word TB? No check internet, no spy. Everybody, oh yeah, let's go. Okay, I understand staff to be TB, to be cough. Hmm. Hmm. Okay. Elizabeth Moriba, happy Sunday. Oh yeah, make una talk now. Hope we know whether you understand before we start. Okay, Dr. Israel, no time. Make we no waste time. Make we no waste time. Make we start. So make I hand over to you. Oh yeah, Dr. Israel, take over. Let's go.
Okay, today we dey mark World TB Day. We just is of public health important because TB dey cause a lot of problem to many people, and even though TB dey with us for a very long time, most people still never get the full information about TB. And we dey try to see say by the year 2030, we are able to end TB. Like TB, we're not going to see new cases of TB again. So this one are also a way to take remind us say yes, there's TB and we need to end TB. That's why we dey do this program. As a team for this year TB what TB Day is, it's time to end TB. So it don't really reach the time make we end TB. So what TB TB? TB na tuberculosis, tuberculosis, and it is caused by a bacteria. Eh? It is caused by a bacteria called Mycobacterium tuberculosis. That's the bacteria when they cause tuberculosis. And tuberculosis is divided into two. We dey get pulmonary TB, that is pulmonary tuberculosis, and extra pulmonary tuberculosis. When we say extra pulmonary tuberculosis, we mean say tuberculosis where they affect every other part of the body outside the lungs. So pulmonary tuberculosis means say now the lungs na na dey affected, and that one dey in quote na dey common pass. Yes, other form of tuberculosis dey and still dey common, but the extrapulmonary tuberculosis na somehow dey more common pass. And I also make am dey of a public health important because of how e dey spread and how e go fit take get to another person from one place to another. So it simply means that it's also a communicable disease because it can be spread. So that's just a brief introduction of tuberculosis. I no one come dey bore us with figures of numbers when
Hmm.
how many people don't die for tuberculosis and how many people don't dey affected. No, let's leave those numbers. Now, may we just get the simple things when we need to know when go help us so that we go fit get the best and we ourselves go fit take care of ourselves as well. Yeah, Dr.
Hmm.
Fred.
Yes, thank you so much, Dr. Israel. If you just they come tonight, we dey talk about tuberculosis today. And we ask a lot of people with the TB, wetin e mean. Now, some people talk say na infection, na bacteria. And Dr. Israel don't tell us say TB, na bacteria they cause am. He tell us the name of the bacteria. But I want to add something, may you understand. TB is curable. TB, tuberculosis, is preventable. So make it there for your mind because lots of people, whenever they hear TB like this, they don't they fear, they don't they cry, say, hey, my own don't finish. No, I better calm down. That is waiting we want me, you know. Dr. Israel talk am again, say TB they affect lungs. Also, if it affect other parts of the body. When you hear somebody get tuberculosis, we will let you know, say, TB, that bacteria where they cause them, if it affect person for lungs. At the same time, if it affect person for the kidney, for the spinal cord, even for the brain, if it affects them. Now, no, we can't talk about how people take they get tuberculosis. But before we talk, I want you where they watch me, wherever you they watch me, like whether you did Facebook or you did YouTube, like this video, share the video, make more people can understand about tuberculosis. So make I hand over to Dr. Israel, who will break down how people say they get tuberculosis. Dr. Israel, over to you.
Okay, and tuberculosis, and there are different ways when person fit take get tuberculosis. Remember, I said we say tuberculosis can be pulmonary to TB and extrapulmonary TB. So it means say there can be different way when you fit take get am. Now the first way when you fit take get am na when you dey with person when you get TB and they cough, then you inhale and so through inhalation, we fit get TB. So apart from that, there are exogenous way when we fit get am, hematogenous way when we fit get am. That is, e first dey the blood and dey the lungs, e dey there, e no dey do any problem. Or for those wey don already get pulmonary TB, when be say the body be don help hold some of them, but because the immune system don reduce, those TB wey dey the lungs or the blood fit come transport themselves enter other part of the body, or come cause TB. Yeah, the first one na dey very common. That is the one wey be say through infected person wey dey cough. Then as this person dey cough, other people dey inhale this cough, or the person dey sneeze, other people dey inhale wetin dey come out, wetin dem dey cough come out. So that one is the major way. So through inhalation is one of the major way wey you fit take get am. But I just talk through as hematogenous route. Then we get the one wey we dey call bovine TB, wey be say fit affect the intestine. That one na through unpasteurized milk. People wey dey take cow milk wey dem no reprocess, just raw one from the cow milk and you drink am. So all those people fit come down with intestinal TB. But that one no dey too dey common again, because most people no dey too do that kind practice. So the most commonest one still remain that through inhalation. When the person wey get TB, e cough within the, even before e start treatment, and within 2 weeks after e start treatment, when e cough and people around them inhale the cough and their own immune system not too dey good, so they go come down with TB. Now, this is to tell us, say, once we get good immune system, when our immune system dey very, very good, we fit dey close to people when get TB. And because our immune system dey good, we no go come down with the infection, because our immune system go fit help us capture this TB and contain them for one place, so that may they not cause any symptom for us, and we go fit still live life normally. So that's the way of TB to take transfer from one person to another.
Thank you, Dr. Israel. If you know here well, with Dr. Israel talk, say some people now when they cough, people maybe they get them for their body, they can't cough. That is why we they beg our people. So whenever you want cough, they make you know how you they cough. May you not go carry TB for your own body, spread them one way, or maybe the person think all those droplets come out. You can't go breathe them in if you get them, or through blood. Then you get some people who say TB if you catch them more. As Dr. Israel mentioned, their immune system they low. The immune system never strong. People will get immunosuppression, or elderly people, or people with they smoke, or even the people will get HIV. But again, one thing I want to add before we go further again. You get some people if they get TB for their body, it no go give them infection. It go dey inside their body. We dey call them latent TB. That is, the TB dey the person body, but it no get symptom. The person immune system, it don't hold that bacteria, it don't keep them for somewhere, it don't lock them, make it no fit cause problem. It go dey the person body, dey like that. But along the line, if that person immune system can't go down, or one or two things happen, that TB where the body don't lock, keep for ground for somewhere like that. If you wake up, we use the word reactivates, can cause problem. You understand? So you go to look me say, forget me, I know they cough now, and my body they okay now, everything they fine with me. What if you there among the people we get latent TB? You don't understand, right? Very, very good. We don't talk about waiting the TB. We don't talk waiting the cause them, who and who fit get them. Now, one break them down. Let's go further to like waiting you go see when person get TB. Now, before I hand over to Dr. Israel, if you dey hear me, you don't understand what we dey talk, they come since. Put them for the comment section. Like and share, I beg. Make more people come learn. So, Dr. Israel, let's talk about some of the symptoms about TB where our people need to know about.
Okay, the symptoms of TB, the major symptom for TB in a cough. So that's one of the major symptoms for TB. So when person don't dey cough for more than 2 weeks, Eh? We feel the thought say yes, this person need to go test himself for TB. So cough for more than 2 weeks, 2 weeks and above. And recently, now the computer has cough for 2 weeks. Before we feel your thought say cough, cough we don't tea, for more than 3 weeks or so. But now cough of at least 2 weeks, and more than 2 weeks and above. So this person need to go. You need to go check himself. So apart from cough, e go dey get night sweat, drenching night sweat. When we say drenching night sweat, e mean say the person dey sleep for night, you notice say e dey sweat well well, all im body go wet. um E go be like say dem pour am water for body. Sometimes e dey be like that. And another thing wey we fit still dey describe am be say everybody wey dey around you no dey feel heat, no dey feel sweat, but you go just you go dey feel sweat well well. So those one na drenching night sweat. And then the third one na the person go dey lost weight. The person go dey lost weight. So in some cases, some persons fit come dey get loss of appetite, e no go dey eat well. So the first three wey I mention na the three major symptoms when person wey get TB fit get. So how the cough dey be? The cough most of the time e dey productive. So that is sputum dey come out. And when you cough, something go come out from your mouth when you don cough. And that cough, the sputum go either be
Mm.
whitish sputum, or sometimes that cough fit come contain blood. So e mean say some people when they cough blood, they fit still need to check themselves. And also sometimes this cough go come dey cause chest pain. So chest pain come still join one of the symptoms of TB. So we don mention coughing of blood, coughing of chest pain, cough itself of more than 2 weeks, and the cough dey productive of whitish sputum, or cough dey productive of sputum. Then we come dey see night sweat. So this person dey sweat for night. Then weight loss, the person don lost weight. Sometimes the person fit still get fever. And another thing is that the person go dey tired most of the time. Also, the person fit no dey like to dey eat food again. And sometimes the person fit dey get chills, that is, you dey catch cold and the body go dey hot. So when you see somebody with all these symptoms, and another thing wey we dey add join when we dey try to find out is when you see a person with all these symptoms, you come see say e dey close to person, another person wey dey cough all the time, there's every tendency say this person fit don get TB. But I no say e don get to, because these ones they are just symptoms, and they are just things that these persons are when this person don bring come out, when we go fit take look to find out if this person really get TB or not. So those are the symptoms of TB.
Thank you, Dr. Israel. I see some people just dey enter again. Today na TB we dey talk about. So abeg, if you ask us any question wey no dey related to today's topic, we no go answer you. We no wan comot for this topic. Na there we dey today. You understand? Dr. Israel don mention the symptoms of TB. If you get questions about TB, no worry, we will answer your questions. He spoke about the cough, the fever, person fit go dey lose weight, go dey sweat for night, and many, many other things. Now, person don dey cough, dey cough, dey cough, dey cough, dey cough. Doctor, how we go take know say this person wey dey cough na TB e get, abi na something else e get? E get anyhow wey una fit test am for social media, on the internet? E get how dem dey treat am? So wetin I dey try tell you be say, okay, how we go take know say this person im cough, wetin dey do am na TB, no be TB? How we take dey arrive at diagnosis? And that one we wan talk. So when person dey cough, make I talk one test. When person dey cough, like Dr. Israel mentioned, the person fit dey cough out something. That thing wey dey cough out, they go give am cup, container, may e cough inside. And then when the person cough inside, they'll come cover am, come go do test on top that thing wey the person cough, to know whether e get that bacteria wey dey cause TB. Especially for somebody wey don dey cough for like 2 weeks, the cough, e no gree stop like that. Maybe come dey lose weight, come get fever, come get night sweats. Other tests still dey. So make I and now make I add something. If you get questions for us on TB, Just wait. We go take your question, relax. May we break them down. So Dr. Israel, over to you.
Okay. For diagnosis of TB, we get one what they call gene expert. I believe that's what Dr. Fred would they try to explain. Gene expert. So that's like one of the main tests when they do to take know if person get TB. So when the gene expert say this person is positive, it means say the person dey positive. However, other investigation when person go fit do, because sometimes gene expert fit say the person dey negative, whereas the person get the TB. So chest history is still dey very important, but you know your fit look always chest history and say yes, this person get TB. So you go check chest history and follow with the symptoms where this person don tell you. This person get cough, night sweat, eh? Night sweat, and they lost weight. Then you check your chest history, you can see some cavitation. You check the chest history, you can see some round like gun focus. When be like say they round for the chest. So with that one go still give us that information. Say yes, this person he get TB. So e get the one wey they first they do that time before, but now they know they too use them. But yeah, they still do it, but not for mainly diagnosis. They call am mantle test. Mantle test can also be used for TB. I will get sputum AFB. So sputum AFB is also another test when we physically use to check if this person get TB or not. So these ones when I just mentioned are just the most simplest investigation that when we will fit do, because the other high one wey person fit still do. Now e get one wey dey call TB lamb. TB lamb na the another way when you go fit take check whether somebody get TB. Mostly in this case we no dey use sputum take dey do am, na urine na we take dey do am. So when person get extra pulmonary TB, so with TB lamb person you can actually know if this person get TB or not. So there's also another one wey dem dey call LF lamb. TB LF lamb. So the TB LF lamb is mainly used for patients when you get that are immunocompromised, that is HIV patient. So now that they quick use that one, they use that one for. So that one can also actually tell you if this person gets it, because most of the HIV patients, when because TB and HIV, they be like 5 and 6, they are like brothers and sisters. And so people when get TB, once you come test for TB, the next thing when they want test you for na HIV. And sometimes when the person get HIV and we hear say they cough, even though na for one day. In fact, once we hear say they cough, the next test we they do for that person now to go check for TB. So for every patient when you come see us and we find out say this for HIV patient that the CD4 count is less than 200, one of the tests we they do for that for whether they cough or whether not they cough na LF lamb. And LF lamb to check whether I get TB in any form. And in most cases, we don't see cases like that the LF lamb will come positive, and you treat them for TB, and they get better. And in some cases, you see the LF lamb come positive, you go do the gene expert, the gene expert will come positive. Sometimes the gene expert will not say positive, but as far we have that LF lamb as positive, we also go ahead to treat for TB. So these ones are the few tests when we feel use take diagnose for pulmonary TB and or other extrapulmonary TB. So before I hand over to Dr. Fred, let's just use that talk about the risk factors and the risk factors for TB. Now, when we talk about risk factor not mean say because you get all these things, it means say you don't get you must get TB. No, risk factors simply means say these are things that will expose you to actually get TB. So if you have those risk factors, it means that you will likely get TB, but it's not a compulsory fact. It's not compulsory say you must get TB. Now, when you dey with somebody when they cough is a risk factor for you, because if that person they treat himself for TB and you are the one with that person, there's every tendency say you yourself feel come down with TB. So people when dey overcrowded environment, when dey overcrowded environment, they fit still come down with TB, mostly if somebody within that environment get TB. So the spread of TB in that place is very, very fast. So people with immunosuppressed that are immunosuppressed, it means say they get other comorbidity, they get other illness, other illness like HIV, or they use immunosuppressed medication. That's when we say immunosuppressed, we they talk about things wey go fit suppress their immune system. So these kind of people can also, they can also get TB. Now, people wey dey work for nursing home, they are prone to have TB. Even doctors, nurses, when they work for TB centers, they are prone to have TB. So another set of people na those wey dey smoke. So if you are smoking, you dey smoke any kind of smoking, you are prone to have, TB. I don talk say people wey get chronic disease like cancer, like diabetes, like HIV, they are also prone to have TB because their immune system is down. E no mean say because you get all those things you must get TB, but e mean say you need to dey check yourself very well because you may likely come down with TB.
Okay, thank you so much, Dr. Israel. Ojo Charity, Yewande, Kofi Bleble, Laurencia, I see you. Welcome. Good evening. So we dey talk about TB. We don't talk about many of the things where they cause TB, how people say they get them, the symptoms, how we say they diagnose them, because they don't break them, how some people feel live their life carelessly, you understand? People will smoke and many, many other things, immunosuppression, they give you TB. Or people to at risk to get TB. Now, if somebody gets TB for body, if you give the person problem, yes or no, wetin go happen if somebody get TB and dem no treat am? Like, okay, oh, this person just dey now, he get TB, he say he no wan collect medicine. Wetin fit happen? So we're talking about like the complications of tuberculosis. Then how the con take dey treat am, because e dey important. Make we talk about how they dey treat TB too. We'll come take your questions. So make we talk about am. So Israel, please go ahead.
Yeah, if person get TB, they get many complications wey fit follow am. That mostly if they no treat am on time, or if they no even treat am at all. So if person get TB, yes, he can stay for at least, I think, for 2 years or so before he finally die. That is if he not treat am at all, before he finally poof. But if he treat am and maybe sometimes he not treat am well, or the thing stay for a very long time, it can cause problem for the lungs itself. It fit even cause consolidation for the lungs, it fit even cause hole for the lungs. Dat na one. E fit even damage the joint because TB spine, that one go damage, e fit damage this joint. E fit cause problem to the liver, to the kidney, and e fit cause, it fit even cause problem to every part of the most of the bone, even the intestine. It fit cause perforation for the intestine, wey be say the person go need to go do surgery. Or even if care is not taken, cut some part of the intestine and comot. This and the last complication na the person fit poof, the person fit just go meet the ancestors. So that's the last complication. So we need to be wary of this complication, mostly the one wey be say it cause problem to the lungs, because when the problem to the lungs start, it can actually still affect the heart, and so the person fit come dey even dey get heart failure and all that. So make we just dey careful so that make person for fit save himself and stay alive, so that he go enjoy as long when God wants make he enjoy. Dr.
Thank you,
Fred.
Dr. Israel. Before I continue, yeah, thank you, Dr. Israel. Oyet Dominic, I want to say thank you for the stars. Oyet Dominic just he sent stars. I see the stars where you send, and I want to say thank you very, very much. Thank you. Now you don't hear the kind of complication we fit happen. Oh, we go soon take your question. No vex. Remain small. Remain small. If person get TBM, they don't confirm am. They'll come take the person data, name many things. They'll come give the person medicine. But you get how the treatment they be for TB. The treatment of TB, they be like every other treatment, every other medical condition out. Remember, TB, tuberculosis is curable. They cure am, they treat am. So no be say you go get TB now, you're going to cry, say your own don't finish. Everybody go to run leave you. No, it's curable. But you get how they take manage which you need to know. I go allow Dr. Israel again, put one or two words, then we'll come take your questions. So if you get questions now, start to descend them. Make Dr. Israel answer this, talk about the treatment. Dr. Israel, over to you, please.
Okay. The treatment for TB. Now, as Dr. Fred they use and sing today since say TB get cure. So we need to know say yes, TB actually get cure. It's curable. So not be disease when be say once you get and you no go feel they no go feel cure. No, TB is curable. All you need to do is you need to be disciplined in taking your medication, and you need to take it as they tell you make you take them. So they get centers where TB can be treated. And you should know, say, treatment of TB is also free. Even the test for TB, the gene expert test itself, now free. But if they say make you do chest X-ray, all those ones you need to pay for that. And in some centers, they fit tell you make you pay for your card and all that. But the medication for the treatment for TB now free. Any other medication when you buy, any other thing when you pay for is maybe for other things around what they are treating you for. So I also want us may we know that just know say the test and the treatment for TB is free. Now, how they treat TB? So for person when they already get TB, and the cost is for 6 months. 6 months. So that's is a cost of 6 months. So you need to take the drug for 6 months. So for the first 2 months, which they call the what do they call it again? Um,
Initial.
mm, yeah, the initial phase. Yeah, I thought it had another name.
Yeah.
The initial phase. Yeah, that one that they use four drugs, four different drugs. So they'll give you that four different drug, and you take it for that for first 2 months. As you they take a note, one thing when you suppose know is that before you start this medication, now you did very now you go fit transmit the bacteria to other people if you get TB. Now, when before you start the treatment, now you fit transmit them to other people. However, 2 weeks to when you start the treatment, you not go fit transmit the bacteria, even though you cough, you not go fit spread to other people. So for the first 2 months, you take four different medications. But now things don't change. All this they call them four medication. Nowadays, they don't put all this four medication for just one tablet, or sometimes they fit don put all this one medication for two tablets. Depends on the place where you go take your treatment. So the first 2 months they give you the four tablets. After the four tablets, after that 2 months, they go retest you, and they go retest you. So some people when they retest them, sometimes they fit still come out and see say yes, they still get the TB. While some people when they retest them after the 2 months, they go find out say the TB don already dey show negative. Even though they show negative, not mean say make you stop the medication. We still get the continuous phase
Mm.
of 4 months. But this time, they will not, instead of four tablets, they'll come give you two. Now only two medication now you need to take as at this time. And you go take them until the fifth month of you taking this drug. On the fifth month, they go retest you again to be sure say yes, you dey negative, or if you still dey positive. If you still dey positive, they no mind, they may want to continue the medication. However, by the fifth month, for most people when we know, at the fifth month, they don't the TB don't it don't go. So after they don't take the drug for after they don't do the test on the fifth month, they go continue their medication to complete the drug by the sixth month. After they take the drug by the sixth month, they go repeat the test. Now that test, now they go take discharge you to they say yes, this person not get TB again. Now, in some cases, after your first 2 months, and they notice say you still get the TB still dey show positive, they go want add one more month to it again to make it 3 months. That is your intensive phase. Yeah, the intensive phase will become 3 months before the continuation phase, which will also become 4 months. Then they go do the test as I earlier said, and then you go end the medication. Now, this one when I just talk, now for our normal pulmonary TB, there's the TB where affect the
Mm-hmm.
lungs. Every other part of the
The
TB,
lungs.
all of them get their own different months. All of them get
Mm.
their own different months of treatment. Some they reach 8 months, some they reach 10, 12 months. So it now depends on the kind of TB when the person gets. That they go fit take give you, that will fit tell you how long you will treat the disease. But just know say for pulmonary TB, it's 6 months. But as I earlier said,
Dr.
you need
Israel,
to be
thank you.
disciplined and you need
Yes.
to,
Yeah. You don't finish?
yes.
Okay. Okay. Now, we're talking about TB. If you just dey come about TB, we don't talk so many things where you need to know. If you get questions about tuberculosis, I beg drop them, ask us, put them in the comment section about tuberculosis. So if you ask us any other question, we know they related to the topic, we not go respond to your question. Now, TB can affect the lungs. At the same time, that same TB fit affect other parts of the body. Get some people they fit get TB for their intestine or for their spinal cord. Fit affect them for bone, for spine, what they call Port disease. Fit affect them for head, many things. And you get how they treat them. But one very important thing we want me you know be say when they start you on your medication, no stop am o. We talk say, I don't tire. I no fit continue my medicine. No. Because when you stop, you no complete am halfway, you fit go develop resistance. And when resistance come enter, you don't allow the tuberculosis may e tie wrapper, eh? May e tie wrapper inside your body. So when they put somebody on the medication, we encourage them. We know say e no easy to take medicine for a long time, but if you follow all the advice wey dem give you go treat am, you go cure am. If you understand wetin we don dey talk since morning dey come, put am in the comment section. Say, I follow you and I understand. Na TB we talk about today. So no come dey cry or dey run. I hear say that person don get TB. Hey, run. No. Why should he be doing that? You understand? So put am in the comment section. Say, I understand. I follow you. Then if you get questions for us about TB, eh, I want make you put am in the comment section. We go take your question. Okay. And then share this video. Share. Let's see. Share the comment. Following. Okay. Manuel Do, I see you. Manuel Do, they follow us. Okay, I'm following. Let's take a question from Dr. Josephine. He said, good evening, doctor. Can one be exposed to TB, that is tuberculosis, without getting it? That you follow someone to the hospital and the person tested positive and was given the medication, and also without coughing at all. Oh, is it possible? Dr. Israel, we'll break them down. We'll answer this question.
Eh, remember when I talk, I said yes. People people can be at risk of having TB. Don't mean say they go must get the TB. And also, it's also depend on your immune system. So if you have good immune system, you may not likely come down with the TB. But if your immune system not too dey strong, that is when you go dey fear say you fit come down with the TB. However, there are some other things wey you need to do even when they are treating the person wey get TB. There's what we call contact tracing. So for everybody when we
Mm,
do test for and it come out positive, we do contact tracing. When we say contact tracing, we want to look for everybody when they are around that person, mostly family members, those wey dey stay with am for house, and every other person. We go call all of them and we go do test for them to find out who and who fit don dey affected. Then for children wey dey less than 5 years, most of the time we fit just start them on prophylaxis. TB prophylaxis na drug wey dem go take to take prevent them from becoming I wan say HIV, from take prevent them from becoming TB positive. Because yes, children of less than 5 years, you know, their immune system still dey very weak, never too strong. So they are prone to come down with so many many diseases. So because of that case, that's the reason why you need to give those people prophylaxis so that make them not come down with the disease. So while every other member, maybe adult and all that, we could just call them, test them. If they not get, for some most cases, we'll let them be, but we'll tell them, we'll give them preventive measures, what they need to dey do to take make sure say and then to not come down with the disease. So for you, if you escort somebody go that kind of place and you find out say they positive or so on and so forth. Now, I remember I
Mm.
said once they don't start medication within 2 weeks, they not go fit transmit the disease again to any other person. So you too need to first of all within that period they close your mouth, they cover your mouth and nose with face mask, or even the person that has it should actually cover the face, the nose and mouth with face mask. And you also need to learn etiquette is very, very
Mm.
important in this matter.
Thank you,
So
Dr.
when we start to
Israel.
look at the preventive measures, then we will talk more of that.
Okay. So, Josephine, Edokpai Josephine, you don't hear, Abi. Very important. Say contact tracing. Everybody we don't dey in contact with that person, they go trace and find out whether he did the person body and other stuff. I beg, I beg, I beg. Some people they watch us for YouTube and you never comment. I dey see una. Just drop comments. Make I give you shout out. Everybody where they watch us for YouTube, yeah, drop your comment. So let's talk about how to prevent tuberculosis. Is it possible? We go fit prevent them. Wait dey where we'll find out. Okay, Israel. Okay, wait, we have a question here. So after this question, we still get more time. Then we'll come talk about prevention. Let's take this comment from Moses. He say, I am on the second line treatment for 2 months now, but still coughing. Can this cough go away?
Yes, the cough can
Okay,
go
Israel.
away. Now, even though you are still coughing, uh, Dr. Fred, did you hear me?
Oh yeah, go ahead. Go ahead. I dey hear you.
Okay, now even though you still dey cough, yes, the cough will likely go away, except if you no dey take the complete dose. Now, in treatment of TB, there's what we call DOTS and direct observed therapy. So that one means say you are supposed to be in the hospital mostly for that intensive phase. For that first 2 months, you are supposed to be in the hospital. The person go give you go swallow am for a present, and that's DOT. That's what DOT means, and mostly for that first 2 months. But well, the situation of things for Nigeria, how they make things like that, they 100%. Yeah, even not only this country, but yeah, on that on a soft note. So, but even though you see the cough, you go also notice say that your cough don't reduce. It's not as it used to be when you start. So before you end the medication, before the 6 months finish, I believe the cough will also go. Mostly if you are taking the right medication. And if really not TB be the problem.
Okay. We have let's see. Do we have any question here again? Let's see, let's see. Let's take one more again. Okay, it says, is it possible for a woman with HIV? Ah, this question. Okay, because say okay, 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 more take am. But is it possible for a woman with HIV not passing it to her partner? A friend of mine, ex-husband, told me she has it, but him no get am. Is it possible? Now because na HIV, to say na that thing we no go take your question. But Israel, we just put am inside because of TB and HIV.
Okay, I no go talk much on it because we know they talk about HIV today. So if you really want to get the full story of this, follow my page. And I think I've done a video on this. And just follow my page and watch all my HIV videos. And you go hear one on your answer to that question. You did there. Yes, the person is possible. The person not go get am. The partner not go get am. It's possible. There are things that can be done. If the person that is HIV positive is taking his medication very well, and he can't, the other partner can't they take prep, e no go get, e no go, the negative partner they take prep, pre-exposure prophylaxis drug when we dey give for those wey dey negative. The negative partner no go get am. So it's 100% possible. It's 100% possible.
Okay, one more question. Then we talk about the prevention of tuberculosis. Can one use the same spoon with someone that has TB? That is, person will get tuberculosis. He chop. Can somebody else carry that person's same spoon they use and chop as they chop together?
Okay, I wan ask you question. Before you come do the diagnosis, come find out say that person get TB, you no dey use the same spoon with that person. If by that time when we know talk say na that time na even dey very, na e fit spread well well, you use the same spoon with that person and you no feel am. Why e come be say na when you come find out, you no get am that time, when you come find out, now you come think say you go get am. So I think that
Mm,
what I just said, I've answered the the question. So um the virus cannot be spread by touching surfaces. So TB, maybe person cough and the TB bacteria enter table. Say you can't use your hand carry am. It's not, you cannot be it cannot be spread out in that manner. So you fit shake somebody when you get am. You fit use the same spoon and plate with the person. You no go transmit the virus to you. Remember, sorry, I say virus. Sorry. Now, but and HIV dey my head. Sorry, you no go transmit the bacteria to you. As I earlier said, as we said, once the person don't start medication, within the first 2 weeks, he cannot even transmit the bacteria again. So think about it. Think about the first talk when I said, if before you even find out, you dey use the same spoon with the person, e no enter your body. Now when you can't find out, now you can't enter your body. So if you
mm,
not go enter your body then, so you not go still enter your body when you find out.
mm. And if you dey follow us since the beginning, we talk say, and when person cough, you can't go breathe am enter inside your nose one way, go enter, go your lungs. That is why people wey dey cough, you see person dey cough anyhow, just open mouth dey cough, you need to be careful of that person. Tell am say cover your mouth because you no know wetin the person dey cough out. Just to support Dr. Israel when he talk say if you shake person wey get TB, you cannot carry it. This will now lead us to the next part: prevention of tuberculosis. Wetin science don do to help us wey be say TB no come dey common? Wetin come happen wey be say we come dey see TB nowadays? So we'll talk about that one. And if you still get question, drop your question in the comment section. We will take them for you. And don't forget, share this thing, make our people learn. Share. So Israel, let's go, please.
Okay, and Dr. Fred, hope you dey hear me clearly.
Yeah, they hear you. They hear you.
Okay, because for your stuff they crack from my side. Well. Okay, no problem. And for the prevention of TB, ventilation is a very important part and to prevent TB. So you must be in a house that have good ventilation. When we say good ventilation, both your fan, your windows, and how they take build the house, how air take they pass from one place to another. So it is very, very important that your windows, your window is almost opposite your doors, or two windows are opposite each other, and so that air go they pass one side, they pass the other side, they come, breeze go dey pass one side, they come, they pass the other side, they come out. Even though it's not 100% opposite, but at least make them not the two know your day one side, and it's very bad for your room to get just one window. Overcrowded environment, you need to run away from overcrowded environments, because we don't talk and say when a place that is overcrowded, transmission of the TB is
It's
e
high.
dey easy. So when you don't come off from e dey high. So when you don't come off from that kind of environment, you go actually dey save yourself. They actually dey prevent yourself from tuberculosis and every other infection and that can take place in that kind of environment. Smoking, stopping of smoking, is also very, very important. So cough etiquette is also another thing. So when you want to cough, you should know coughing and sneezing. So you are supposed to cough into your elbow like this. And for those when they stay with people when get TB, you're supposed to make sure say the person when get the TB they wear a face mask mostly for that first 2 weeks when they don't start the medication. And for those when they work for TB environment, they're also supposed to be wearing face masks to protect themselves from coming down with the disease. So clean environment is also very important. So your environment they very if your environment they very clean, it go make sure say breeze better breeze they enter your house. And if breeze they enter your house, they also they blow off germs and anything with dust away from your environment. So those are few ways when you go fit take prevent when you go fit take prevent TB.
You don't hear the few ways to prevent TB. Or Dion, are you just coming? Waiting no
Then the
clear for
last
your
one,
question.
sorry, the last one is vaccine. And I make we dey give our children vaccine, the
Yeah.
BCG vaccine. So I almost forget that. That's also one way to prevent TB. So once you give birth to your child, I beg, and within that few time, within the short earliest time, please give your child BCG, and because that one will also prevent your child from tuberculosis. Thank you.
Okay. Thank you. So we have a question here, and this person is misunderstanding the response. I believe you did not follow us from the beginning. So the first question where you ask us, we say mode of transmission is not understood. Okay, no problem. You can't talk, say, if it can't be transmitted through saliva, and why do lab scientists request for the test? Very good. So I believe you maybe you ask based on the question where somebody asked about spoon, and Dr. Israel told you something that if the person take medication within that 2 weeks, after 2 weeks, the chances to spread is the virus, sorry, the bacteria don't go down. But if you follow us from the very beginning, we talked about how people take they get them. And one way, and when you inhale the droplets, you understand, it go enter your lungs. We can't talk say to even do the test. Sputum, they very important. We mentioned this, but we are answering the question. So we never said that they use sputum, not saliva, because waiting you they cough out. If not from your just your mouth, you know go pick them. But we go tell the person say when you want to cough, try to bring it from inside, not just saliva from my just spit. No, it's deep inside. I will allow Dr. Israel add another response to this.
Fred, Dr. Fred, you just answered the question. There's difference between saliva and sputum. And there's different, Dr. Fred, okay. There's difference between saliva and sputum. So that's one thing this person needs to know. Because he said, if he said it's not transmitted through saliva, why would the lab scientist say you should bring sputum? So those two things are two different things. Eh? So yes, if you give lab scientists saliva, you will not get the bacteria from it. Eh? You will not get the bacteria. That's why even in taking the sample sometimes, they even teach person how you take and they'll tell you say make it come out from your inside and from your inside.
Mm,
Guys that say they say make you do that you can't you can't come out from your inside and when you give them. So if you just do your normal saliva when your mouth give them, it not go come out. So if it not go come out for your normal saliva, so how can you not get it through that means?
mm. And if you don't see person where they cough, it gets some kind of cough, the person will they cough, the cough go dey deep inside. As a cough, it go spit out
Yeah.
something, go be like something dey inside the chest. When they won't collect your
Yes.
sample, they will tell you say make you bring her in, not just cough dey my throat, I just cough out. No, because this bacteria it dey deep inside your airway. We dey try to break
Yeah.
am down, make you understand. So if you just dey come, very important, TB is curable, TB is preventable. We talk about vaccines. Remember, when they born pikin, they go give am vaccine for hand, to help am prevent TB. Spoke about even your immune system, where you dey live. If you dey cough, that is why when you see person wey dey cough for where you dey, tell am cover your mouth, This whole idea of person go dey inside motor, go just a cough inside the bus. They share microorganism dash all of us.
The
May
share
we stop
things.
am. They just they dash everybody, even when you no ask am, may he give you, he don't give you. So audium, you understand, right? Very good. Now, if you still get question, I beg, ask us. Our time is almost rounding up. We don't want to spend too long time on the program, 1 hour, and then we are done. If you get any questions, still ask us, I beg. If you dey ask for our number, I beg, oh, we know they give number on the internet. Ladies and gentlemen, we just dey here to teach you. So use this opportunity and ask us any question where you get TB. And don't forget, you can follow Dr. Israel. For those who want to know more about HIV, you won't really understand HIV, follow Dr. Israel. You want to learn more, still follow Dr. Israel. See him page and then ask us questions. Oh yeah, if you don't get question, let's do a recap as we round up, Dr. Israel.
Okay. In summary, for everything we don't talk, we just let you know say TB is caused by a bacteria called Mycobacterium tuberculosis. So now be the bacteria when they cause TB. Yeah, there are so many species, so many family members of that Mycobacterium species. There are so many family, but Mycobacterium tuberculosis now they very now we they talk about when they cause TB. And apart from say we say it dey cause TB, we also let us know say there are two type of TB. We have the pulmonary TB, then we have extra pulmonary TB. So it means say TB fit affect every part of the body. It can affect the spine, it can affect the different part of the bones, it can affect the intestine, eh? Um, it can affect the brain, and so on and so forth. And so it fit affect any part of the body, but it dey commoner with the lungs very very much. So and I'll also let you know say TB don't kill a lot of persons and it don't affect a lot of persons even in this country. Now today is World TB Day and we dey try to talk to all of us so that we go fit end TB at least by the year 2030. We go don end TB. New cases of 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 TB, of TB. So we also talk about the signs and symptoms, and we say the major signs and symptoms are people when they cough for more than at least for more than 2 weeks, and this cough could be productive of sputum, whitish sputum. Sometimes it can be bloody sputum, and this cough is associated with chest pain. We also talk about some people go get night sweat, drenching night sweat, then also weight loss. So we still talk about say they fit get fever, tiredness, and every other thing. So we also can talk say the main diagnostic tools for TB na gene expert, but there are other method when you fit take test for TB where chest X-ray still dey useful but not 100% useful, where TB lamb dey, LF lamb dey, sputum AFB, even mantle test, they are still there in the diagnosis or to check for TB. So we went further to talk say the treatment is divided into two phases, the intensive phase and the continuous phase. The intensive phase is for 2 months, while the continuous phase is for 4 months, making it 6 months for pulmonary TB. Every other TB gets its own months, how long they will treat you. Now we say for the intensive phase, now 4 different medications you go to take. While for the continuous phase, you go take two medication. Yeah, and you also I say make I also let you know say the treatment for TB is free, even for the test. The test for TB is also free. Yeah.
Hmm.
Then we also use that talk about prevention and some risk factors. So if you dey smoke, we say stop smoking. That's to prevent smoking because smoking can actually predispose you to having TB. Overcrowded environment can also predispose you to have TB. So if there's no ventilation, it can also predispose somebody to have TB. So be in a place where there is ventilation, learn cough etiquette, and make sure say people wey dey around you still know wetin be cough etiquette, so that make you no dey protect them and dem no dey protect you as well. So we answered a lot of questions, making us know say the difference between saliva and sputum. So most of the time when you do test with saliva, genotype with saliva, you may not get, you will not see the bacteria there, but with the sputum, you may likely see the bacteria there. Also let you know, say HIV and TB, that they go like 5 and 6, that they go together. So most of the time when somebody come test for TB, the next test wey we dey look for that person na HIV. Whether you don get am or not, we just want to do am so that to be sure whether this person get HIV as well. Because HIV na one of those things wey go fit reduce the immune system of that person, and this person fit come down with the disease. Now, these are many other things wey we talk when we dey talk about TB today. Thank you.
Thank you so much, Dr. Israel. We need to round up because this program now every Sunday by 8 p.m. to 9 p.m. Nigerian time. We did very conscious of our time. We don't do this program for about 4 years now, every Sunday. So if you be a new follower, you just watch us for the first time, every Sunday by 8 o'clock Nigerian time, we always say online like this to engage with you. Remember, some people feel drink cow milk, unpasteurized cow milk. If you also carry TB, get TB where they fit collect through that means. Why did I put this one? To let you know that TB is very broad, but we just break them like this for you, make you understand. So please, you see anybody where they cough, don't miss 2 weeks, I beg, let them go hospital, make them check them. No fear, it's curable. You can treat it. You can also prevent it. You understand? Thank you so much for watching. Thank you, Oyet Dominic, for sending stars. We appreciate you very well. Thank you for spending your data on our page. Okay, Israel, any final words as we round up tonight?
Okay, my final word is just that as today mark the World TB Day, let's try and educate one or two persons and to tell them about TB, about how to take care of themselves, how to and about cough etiquette, so that you go also play your role in ending TB. And I will also say let's take care of our mental health, mostly for us within Nigeria. Try and take care of your mental health because things they happen for the country. The and the situation of the country is not smiling, so we will take care of our mental health. So that make person not offend us, we go give the person uppercut when we're not supposed to give the person uppercut. So please, let's take care of our mental health.
Yeah, thank you, Dr. Israel. Please follow Dr. Israel, follow him page so that you will still learn more. And remember, health is wealth. So I beg, protect your health. No use and play. Teach people about TB. Tell them to cover their mouth. If you just say come, no vex. We need to round up now. We need to go. Watch us from the beginning. We will see you again next Sunday on this same program. During the week, I might be online. If you see me online and ask me your questions, I'll always tell you, good life now waiting. Oh yeah, let's go.
Now
Everybody.
spend.
Every, oh yeah, put it in the comment section. Good life now waiting. Oh yeah, let's see.
Now
Good life.
sense.
Now waiting. Now sense. So thank you. Thank you. Thank you. Good night.